Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Because
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you a do-it-yourself DIY neck massage, release tension and pain fast, but you must also know the precautions, right?
Yeah, there's some things you should not do with your neck or it's going to cause some problems. This is great, particularly people working at a desk and you get that tension and tightness and your life is just you're not very productive. It's not fun.
That's right.
This is going to relieve that stress.
And hopefully you
pain.
can do this without medication.
Right. Yep.
You'll get by without it. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. Always giving something away. We don't know what we're giving away today.
Is this
We're not stupid.
Saturday or is this
it's a future video?
A future video. There you
go. I don't know. So go to that channel and go to giveaway section. It'll tell you what we're giving away.
The website.
Yeah, you can also go to Facebook. It'll be pinned to the top of the page.
Right up
giveaway.
there.
You go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
And if you want a longer version, go do our podcast, and we've got some wonderful
You can listen
authors.
to us while you're working out or on the road. Yeah, we have some great experts that we interview on there.
That's right. All right, Bob, we're going to talk about that neck massage. You can do it yourself. You don't need a masseuse. There's some things, again, maybe we should get right away that we're going to work that soft tissue, the muscles,
Right.
work a little bit on those ligaments that are holding things together, stretching, and a little acupressure
Oh, wow.
near the end. But
Not acupuncture,
No.
acupressure.
right, and you can do this right to yourself, and we'll show you a nice, easy way to do that. Precautions, though, I'm going to hit that right
Sure.
away. There's three things that you never should use. One of them, we love massage guns, but we say do not use them on your neck. It is going to be uncomfortable. You could possibly injure your neck, especially if you have some neck problems already.
I also don't like going over artery. So
yeah, especially the carotid area right up in here.
But you're pounding right into that spine.
Yeah,
You can hit lower neck like this.
down in the
traps.
Yeah, but that's inches away from the
Yeah.
spine. See, these massage guns, especially now, they make them that reciprocate forward and backward. It's quite aggressive.
Yeah.
It's too aggressive on the cervical spine. So just forget that. That's
And your
never
head,
do.
too. You really can't use it on your head if you have a headache.
Right. Yeah, that would be uncomfortable.
Pounding away.
Everything that we're doing here should feel good. If it produces any pain while you're doing it or after, do not do that anymore. It should just be completely relaxing immediately. Stop any painful any movements if it creates lightheadedness or dizziness.
Yes.
That means you should stop that. I don't expect. I mean, that's possible. That's a kind of a rare one. Now, the exercises you should do, first of all, get in a chair. A nice chair that the backrest is not too high, preferably. The backrest gets in the way for some of this. If it goes about your scapular or your shoulder blade level, like I'm about here, this is a little high, but it's okay. That's desirable. Firm chair is a little bit better.
Yeah, firm, good posture chair.
Yeah, so get your shoulders, take a few deep breaths. In the nose, exhale out the mouth, and just relax and slow everything down. Okay. Once you do that 3 times, the next thing you're going to do is
I can turn red if you want.
go ahead. Go ahead. Yeah, that's it. Well, you're so tall and I'm so short. I'll stand up. Normally you can do this seated, but because of our height discrepancy.
So you can do circles, and you can do finger over finger, or you can do fingers side by side, and you're off the skull here. You're just right off the skull, right below it, and you're doing circular motion. You can actually go down the spine too.
Yep. Well, I'm already relaxing, Bob.
Well, it feels really good where the neck meets the skull.
Yeah.
That's just the suboccipital area, we call it. That is a really good tender spot for most people, and this feels really good.
I was at actually it was a karate thing years ago, and the instructor, he called that the occiput, the skull pan.
Oh yeah, I've heard
Yeah.
that too.
It's kind of the layman's
Yeah.
term. But anyways, it's a great way to start it. And now the next one. Now, should we go into the splaying one right
Sure.
away? Yep.
So what you're actually doing is putting your fingers together and you're
Here,
pulling them apart.
like that.
And you're applying really decent pressure while
Yes.
you're doing this.
It's almost like you're trying to tear your skin apart.
Yeah.
But I mean, if you're elderly and you have tender skin, you don't want to pull it too hard. But I don't think that'll happen.
Pull the skin off.
Yeah. So from the side, it looks like this, and you'll work it way up again by that occiput right at the top of the neck. Now, this is one I do like to put some extension, or in other words,
While
look
you're doing it.
back and up. And you only do that if it feels good and better to do that.
You can also do a chin tuck.
Sure.
So
Down. Yep.
tuck your chin like that, yeah, while you're doing that.
Boy, I knew our mics are getting in the way a little bit here. So
I'm
was
gonna
that
love
okay,
myself
Tanner?
after this.
Okay. So now this next one, it's the same exercises or massages on my desk. This works much better for me. I think I am going to take my mic off because I know that this is.
So nobody's gonna hear you, Brad, now. So what he's doing, he puts his elbows on a table sometimes,
Right on my desk.
on your desk.
Yep, right where the computer's there, and I just go here and take a
Computer's
break.
there, he said, and he's able to reach that area very easily now. Plus, he's getting a little bit of stretch in his mid back here too. It's actually getting a little leverage on there, and so you're in good posture. Plus, oh, he's gonna put his mic back on. You're in
Keep
good
talking,
posture.
Bob.
You're in good posture. Plus, you're doing the massage. You're getting a double bonus here.
Yeah, and for me, that's a game changer because if I'm up like this, I'm working my shoulders, and it's kind of uncomfortable when I allow my arms to relax by putting support on the elbows.
But
It
he's
really
also
helps.
able to get the upper trapezius way too. Right?
Yeah.
So you
Mhm.
actually when he's leaning like this on the table, he can get the upper right above the scapulas and really pull forward on those. It's almost a spleen massage. You're not going apart, but you're pulling it forward towards you.
You get right over that trigger point too.
Yeah.
And boy, when you hit that trigger point and you get that to relax and release,
Right.
oh, your pain will go from here down to here, and you're putting a smile on your face.
Your level of irritation will go from here to
Yeah.
down here.
The
So-
next one, which is directly correlated to that, is not a massage but a stretch. So what you're going to do, I always would tell my patients, assuming you maybe have a pocket, a chest pocket, is you're going to look down to see what's in that pocket. Take your fingertips only right on the corner or the side of your head here, and gently. It's not to the side. It's not straight forward. It's kind of an oblique or a 45-degree angle. Gently stretch that levator scapula muscle. is
Levator
what-
scapula.
yeah. I never forget. I had a woman. She started doing this at work, and it really helped her a lot. And she was so excited. She told everybody at work, "Come do this stretch." And she's showing, the whole office staff her levator scapula stretch.
It actually does what it sounds like it does. It lifts up your scapula, which is your shoulder blade, and it's a thin little muscle that really can get irritated.
Yeah. And
With
when you
bad
get tense,
posture.
it tightens up,
Yeah.
and that can cause this kind of thing. And
Right.
boy, is that not up, and
Yeah.
it's a painful deal. The next one, now this, I used to use this quite a bit with patients because it's really inexpensive, and pretty much everyone has this. You take 2 tennis balls, take a sock, and drop them in. You kind of have to work them down to the bottom. So there's one here and one there.
Mhm.
Um,
So they're side by side.
Yeah. Now, you cannot do this on a bed. I'm going to show you on here just so it's easy to show, but you need to do it on a carpeted floor. And what we're going to do is get a sock on each side of the neck. And this is a nice one because all you do is I'm going to lay it there at the neck. You're going to find that tension spot and lay on it. It might hurt a little bit at first, but within 20 to 30 seconds, you should feel
It
it
starts to
release.
release.
Yeah. And you just let the weight of your head do the work and just lay there. And you might want to roll it like this a little bit. I'm going to go down. I can feel I need a little more down. There we go.
So is this what you're referring to as acupressure, Brad?
One of them.
Okay.
Yeah. Actually, what you have in your hands there, I
Sure.
would consider a little more acupressure. There. But once you get to the spot, then you just lie there and relax for a minute or two or three. Don't fall asleep though, because we've got more.
I could hook you.
Yeah.
Time to get off the show.
So originally, these devices were everyone, at least in the therapy world, I think, called it.
Well, there's Theracane,
And
and
that's
I
a-
think the Back Buddy.
Oh
I
yeah,
remember right.
yeah. And they're manufactured. I
Now
don't know.
there's hundreds of them out there,
Yeah.
I think.
You can
So,
actually use a hook cane that's used
Yeah.
for walking, but this works better because it's a bigger hook.
right.
Get to more places, and sometimes they have handles like this, and
Yeah, they have knobs all over
yeah.
the place.
the knobs are where you get your pressure from.
Right.
This is the one that
Main
we're gonna-
one, yeah.
You'll get on there, and you simply find the tender spot, put some pressure on it, relax, breathe in your nose, out your mouth, and you hold it for that 30 seconds or more. And
So he's pushing right on the trigger point.
yeah, it's
And
gonna
he's
hurt
trying
at
to get it
first.
to release.
Yeah.
And yes, this will be hurtful.
Yeah, it like right there. I just
Painful.
found it. And
Ooh,
Except
I just
for-
found mine.
Yeah, and then just leave the pressure on there, and if it doesn't release in 30 seconds, it's getting worse. It's too much. It's not
Yeah.
a trigger point or something of that nature. But 9 times out of the 10, it will release, and then you can work around. And that's the beauty of these large hooks, is you can get to locations.
Well, I actually like using these and moving a little bit while I'm doing it.
Ah,
I don't know
yeah.
why. It just feels good
Yeah.
when I do some rotation with it.
like,
But
or you can I'm using that slides right across my
yeah,
shirt, and you can kind of work that. There's no definite rules on this.
No.
Sometimes what can work
what
for you.
feels good. And this is
Mhm.
where I like to use it, like you just did, Brad, on my low back.
Sure.
Oh,
Oh.
baby.
Oh. I guess we better cut it off right there.
Oh,
How about-
sugar pops.
All right. Good
Right.
luck with your massage, keeping your upper body, your back relaxed. Enjoy your work more, and bop.